A pleasant day to each and everyone. On behalf of Brother Bobby, Father Anthony, Sister Suong, and Dr. Estesa Legaspi, I am Joyce and Singson-Quiambao, and with me is Miss Maria Georgia Gana. And we are from Brother Andrew Gonzalez College of Education. Our research interest is in the field of counseling, particularly focused on the challenges, strategies, and experiences of Filipino high school counselors during the COVID-19 pandemic. And for the background of the study, since the onset of the pandemic, most schools in the Philippines were forced to shift to online teaching or remote learning to ensure the continuity of education for students. And data from UNESCO in the year 2020 shows that about 28 million Filipino learners from different education levels have had to continue their studies at home, and the abrupt transition coupled with different challenges of living in these unprecedented times has had a negative impact on our youth's mental health and well-being. And these negative impacts include, but not limited to, the prevalence of depressive and anxiety symptoms, stress, sleep problems, and other emerging issues such as suicidality, technology addiction, abuse, and inequality of access to education. And these can have a significant and lasting effect on students' motivation, academic achievement and success, as well as their behavior and personal development. This has made the consciousness of mental health issues more relevant, and with that, the importance of mental health professionals like school counselors. Pre-pandemic studies point to the positive impact of school counseling programs on students' development through the implementation of a comprehensive program that delivers a broad range of direct services that include classroom instruction, appraisal and advisement, and counseling, as well as the indirect services that include referrals, consultation, and collaboration with stakeholders on behalf of the students. Other than finding ways to deliver guidance services remotely, it is also a challenge for school counselors to address the rising prevalence of students' mental health concerns with the lack of access to student services as a consequence of imposed quarantine and confinements brought about by the pandemic. And with the delivery of some guidance services online, studies also revealed unique challenges that counselors encounter, such as difficulties in connecting to students, limited privacy, and reduced time in student schedules. As they try to address the needs of their students, school counselors are also dealing with pandemic-related anxieties that could hinder the ability to deliver counseling services. Similar to other helping professions, the very nature of counselors' profession places them at high risk of developing burnout, compassion fatigue, and vicarious trauma, which makes it imperative for counselors to practice self-care and to get appropriate supervision. Then our research objective, the purpose of the current study is to look into the roles and responsibilities of school counselors during the pandemic, their interventions and strategies that they use to address students' issues, the challenges they encountered during the pandemic, their self-care strategies, and sources of support and supervision. The insights gained from this study will be used to generate recommendations to improve the delivery of online counseling services, as well as ways to improve the school counseling practice and education in the Philippines.
For our methodology, we utilized a qualitative research design using the interview method. We had a total of 26 high school Filipino school counselors as participants, 42% of which belonged to the age group of 20 to 29 years old, with the oldest being 59 years old. 62% of the participants were the registered guidance counselors, while 38% were licensed psychometricians or licensed professional teachers. The instrument used was a semi-structured interview guide. For our procedure, we contacted the participants and sought their consent. Each interview was conducted through the teleconferencing app Zoom and lasted 45 to 60 minutes. Each interview was digitally recorded. We then transcribed the interviews and analyzed the data. Thematic analysis was used to generate themes from the data, which was then analyzed in context of the research objectives. To ensure trustworthiness, 2 registered guidance counselors reviewed the codes and themes generated from the participants' responses. We will be discussing our results in the context of 5 major points of inquiry. The first one is school counselor roles and responsibilities. The following themes emerged. School counselors stated that they delivered direct services as well as indirect services. Most participants reported that their responsibilities remained the same with some additions. There was increased focus on counseling and checking in on students, as well as finding ways to support students in their online learning. In addition, there was an increase in administrative work, such as issuing recommendation letters and certificates of good moral character. Some counselors also reported that they were assigned inappropriate tasks. Our second point of inquiry is on the delivery of counseling interventions and services. Our results found that counselors delivered similar interventions to pre-pandemic time. However, the most notable change was the shift to remote online delivery of services. Counselors used different platforms such as Zoom and Google Workspace. Participants found that online platforms were beneficial because it allowed students to access counseling services despite the strict confinement in their homes. On the other hand, there were also some limitations to the online delivery of services, such as difficulty administering pen and paper tests, difficulty building rapport with students, as well as privacy, confidentiality, data security, and connectivity concerns.
For the third point of inquiry, the most prevalent difficulty reported is the adjustment to using online platforms. Quite a number of participants reported that they encountered difficulty adjusting to the online platforms that they had to use to deliver the guidance services. And other challenges also include ensuring that the students were getting access to the services that were being provided. Also, the challenge is the fear of infection of COVID-19 themselves, the lack of resources like gadgets, skills, and training, also managing time, keeping healthy boundaries between work and life outside of work, and the feeling of anxiety and compassion fatigue. Then for the fourth point of inquiry, in terms of training, sources of support, and supervision, the participants reported that they were able to receive training for online counseling during the pandemic, which was provided by their own school, as well as the local and international professional organizations in the field of counseling and psychology. And many participants also reported self-learning by continuing their graduate studies in their own research. There are also some who consulted with peers and other professionals, and a few participants reported receiving or seeking no training. Then participants reported that their institution provided support by providing them with training, gadgets, subsidies for internet connection, financial aid, and mechanisms for a safe working environment, such as work from home setup, skeletal workforce for in-person work, and safety protocols to prevent the spread of infection. Then a number of participants reported that their own institutions also set up programs to check in with them. Most participants reported seeking professional support from supervisors and mentors as they navigated school counseling during the pandemic. Many participants also receive support from family and friends, from their own organizations and linkages to cope with the challenges of their work during the pandemic. Then most participants also reported that they have received some form of supervision, but many of them recounted administrative supervision rather than the professional or clinical supervision. And a few reported that they had received supervision from a professional they considered to have more expertise or experience. Then for the fifth point of inquiry, in terms of self-care methods of the counselors, the participants reported continuing self-care methods to help them cope and stay effective during the implementation of school counseling during the pandemic. Then the most common self-care method reported was seeking support from their colleagues and supervisors. Maintaining social connections as part of their self-care, including reaching out and staying connected with family and friends, and getting support from pets were also reported by many counselors. Then for these participants, self-care also includes engaging in activities they enjoy, such as gardening, art making, yoga, watching Korean drama series, and other leisure activities. And having and maintaining a positive mindset was also predominant in the responses. Then setting work-life boundaries and time management was also mentioned by quite a few counselors, as well as taking care of their physical health, maintaining spirituality, getting competencies from graduate studies, and seeking mental health care themselves.
For our discussion, we want to highlight the following points. First, school counselor roles are important, if not even more crucial during the pandemic, as students had to adjust to new conditions. This will persist in the new normal as students will once again have to adjust to face-to-face or hybrid learning environments. Based on the results, we also found that school counselors were able to innovate to meet the challenges they faced during the pandemic and lockdowns. They utilized different platforms to be able to migrate their interventions and services to the online modality.
To add, the school counselors also recognize the benefits of online modes or modalities of delivery, and they also acknowledge that there are limitations to these modalities as well as risk to using them. They also sought to get training to use online modes of program delivery and even found ways to equip themselves with competencies such as seeking consultation from colleagues or mentors when needing to enhance their skills. And in terms of supervision, it appears that counselors mostly receive administrative supervision. For counselors, clinical supervision is very important because it promotes professional development and protects the welfare of counselors. And according to literature, the lack of it has been found to have a negative effect on counselors' identity, skills, and self-efficacy. Unfortunately, not all counselors are fortunate enough to have the opportunity to receive sufficient supervision. The findings also show that counselors do recognize the importance of engaging in self-care methods, and they engage in a variety of activities to ensure that they care for their own health and well-being. For the recommendations, first, school counselor education curriculum should include courses on online modes of service delivery to formally prepare future counselors. We believe these online modes of school counseling delivery will continue even after the pandemic. The restrictions of the pandemic have allowed Filipino school counselors to confront hesitations and manage the risk and challenges of these online modes. It will be helpful for educational institutions to review their curriculum and include courses on online modes of delivery, such as technology-assisted counseling, and also provide other forms of educational activities to continue enhancing their competencies in the use of technology. Second, professional organizations may support counselors by initiating mechanisms for the access of appropriate and adequate supervision. The type of supervision needed by school counselors may not be adequate or accessible to them. Appropriate and adequate supervision has to be explored and addressed as literature proves that the right type of supervision contributes to the quality of service delivery, the counselor well-being and efficacy, and ultimately positive outcomes in student development and well-being. Then finally, practitioners, school counselor, educators, professional organizations, and other stakeholders need to support the clarification of the school counselor role and advocate for this role in the school. Filipino school counselors are aware of the relevance of their roles in supporting students, especially in situations like the pandemic, which pose a threat to student development and well-being. So this is evident in their quick action to equip themselves with the competencies to deliver services in modes that were unfamiliar to them. However, the need to clarify and advocate for this role in the school is still present, especially as the pandemic pushes for evolution and innovation. And the school, the counselor's role has always been multifaceted. So it's not about focusing on one or the other, but rather an integration of those that emerge as aligned with meeting the needs of the times. And that ends our presentation. Thank you for listening.
Thank you.